When I think about end-of-life care, I have two stories that come to mind from my clinical experiences. One of them involved an elderly gentleman who was at the end of life. He had terminal cancer, and we had talked to him about his end-of-life wishes. He had a really good plan put in place, but one thing that he wanted that quite surprised us was having his dog in hospital with him. And we were concerned about how we might facilitate this because A, the dog was enormous, and B, back then we didn't allow dogs in hospitals. But what we did is we sat down as a group of clinicians, the nurses and the doctors talked about how we might facilitate this without upsetting other patients and without, breaching infection control guidelines and things like that. And we worked out a way to get this dog into the hospital. And the change in this man was immense. He was just so happy and so at peace to have this dog in the room with him. It created a few funny scenarios with nurses walking in and finding this enormous dog in the room. But the important thing was this man had exactly what he wanted at the end of life. This dog stayed in the room with him for about a week until he died. The dog was in the room with him when he died, and he was just at peace. He was absolutely at peace when this dog was with him at the end of life. So those communication issues were really important. The team coming together, talking about the issue and coming up with a solution and including the patient in that solution and his family. And that I just remember that story as such a positive end-of-life experience for not just the patient and his family, but for the staff involved as well.